My dear students, today I would be taking up histology with you, and this video would be important for MBBS students, especially the first MBBS students and the students who are preparing for NEET PG and the FMGE examinations. These would be level A questions. Level A signifies very easy questions, so in the initial instance I have taken up some of the easiest of the questions which have been asked in NEET PG, and gradually I will be increasing the standards to other levels. So you can have a look at the board, and the first of the questions which has been asked in the previous years is given here. A NEET or a next PG student is asked to have a look at the image below, and the image below is shown, and it shows a centroacinar cell. Now the centroacinar cell is shown, and the options given are liver, pancreas, parotid and ileum. So in which of these options are the centroacinar cells present? So you have to remember that centroacinar cells, from your knowledge of histology, you have to remember the different types of cells, whether they are the Ito cells, whether they are the PEG cells, whether they are the Golgi cells, whether they are the pyramidal cells or the BAT cells or any other types of cells, in which place they are present as far as histology is concerned. So here the answer happens to be pancreas. And you have to remember different types of cells as I just mentioned. So you can have a look at the board and see Hopper cells present in the chorionic villi or the placenta, the JG cells, which are smooth muscle cells present in the afferent arterioles of the kidneys, the Ito cells, a question so frequently asked. These are the cells present in the liver, the Langerhans cells, which are the antigen presenting cells in the skin, and you have to differentiate between Langerhans cells and Langhans cells. Langhans cells are present in the chorionic villi, but the Langerhans cells are the antigen present cells of the skin. Very important. And you have the basket cells, you have the mammary glands and the sweat glands, which have got the secretions to be secreted out, and the basket cells, which are contractile cells, push these secretions into the lumens. So basket cells are present in these glands. In addition, you can have a look at the board, and there are the jitter cells, the Merkel cells, the Muller cells, the Hylas cells and the glomus cells. Jitter cells are analogous to the microglia of the brain. So in the brain we have got the microglia which form the phagocytic function, and jitter cells is the name given to the microglial cells in the brain. The Merkel cells are specialized cells in the sensory nerve endings, and the Muller cells are seen in the retina. In addition, Hylas cells and the glomus cells. You have to remember that ovary is a very important gland, and in the ovary we have the Hylas cells, and we have got the carotid bodies which are very important physiologically, and in the carotid bodies we have got the glomus cells. So in nutshell, the bottom line is that you have to be well versed with the specific and the special cells which are present histologically in different parts of the body, in the different glands, in the different organs. Now the next question which you can see on the board. The below mentioned slide represents an endocrine gland in which follicles are seen on higher magnification. Cubical cells line the follicles. The most likely gland is the parathyroid, the parotid, the thyroid and the pituitary. The options 4 are given there. And out of our knowledge of histology, histopathology, we can just assume that normal histologically the gland, which is the thyroid gland, is composed of follicles and is composed of cubical cells lining the follicles, and it is an endocrine gland. So the correct answer would be the thyroid gland, which is represented by the option C in the figure. Moving on to the next slide. So we have got the next slide. A next or a NEET PG aspirant is asked by his anatomy teacher, who teaches them histology, to have a look at the image below, and the glands are seen. The glands shown in the figure are the Brunner's glands, and the options given are liver, pancreas, parotid and none of the above. As far as our knowledge of histology is concerned, we know that Brunner's glands are present in the duodenum. we have got small intestine divided into three parts: the duodenum, the jejunum, and the ileum. The ileum is characterized by characteristic lymphoid patches, which we call as the Pierce patches. The duodenum is having this entity as its recognizing feature, and the jejunum is characterless. So duodenum is the correct answer. So going to the next question here, a NEET Next PG aspirant is asked to identify the image below, and the image shows workman's canal, and the options given are epithelium, connective tissue, muscle fiber, and neural structure. From our profound knowledge of histology, we know that epithelium does not have workman's canals. Connective tissue, there are multiple types of connective tissue, and there is this connective tissue, the bone and the cartilage. Especially the bone is characterized by the presence of workman's canal, the Sharpey's fibers, and multiple other things like the periosteum, the endosteum, the lamellae, and the osteons, and the osteocytes, osteoblasts, and osteoclasts. So important is that here the answer is not given directly, it's given in an indirect from a broader perspective, connective tissue. So you have to remember that bone itself is a connective tissue, and the correct answer is option B, which is represented by the connective tissue. Going to the next slide. So sometimes tricky questions are asked. So the next slide is that it shows division of a lymphatic organ into lobes and the well differentiation of cortex and medulla with calcified concretions. The organ is thymus, spleen, prostate, and tonsil. From our knowledge of histology, lymphatic organs are specific, and there are certain organs which are hematolymphopoietic, and you have to remember that the division of a lymphatic organ into lobes, lobules characterized by calcified concretions, which we call as Hassel's corpuscles, is characteristic of thymus. So the correct option over here is thymus. The rest of the options can be ruled out. Spleen will be characterized by red pulp and white pulp, the prostate by different type of epithelia, glands, and concretions, which we call as corpora amylaceae. Tonsil will be characterized by the presence of crypts histologically and lymphoid aggregations. So the best answer over here is the thymus. Moving to the next question, a NEET PG aspirant is asked to identify the image below, and the image shows specialized epithelium in the form of stratified squamous epithelium. And what option would be lined by stratified squamous epithelium? Testes, ovaries, uterus, vagina. We should know the disposition of the epithelium, which epithelium lines which place. Say for example the transition epithelium, say for example the cubical epithelium, say for example the stratified squamous epithelium, as is mentioned in this question. So over here the best answer is the vagina. We know that vagina is lined by stratified squamous epithelium. In testes we have got the seminiferous tubules. In ovaries we have got the germinal epithelium, which is not lined as a stratified squamous epithelium. The uterus is not lined by stratified squamous epithelium. The slide of the uterus would be representing much of the tissue, muscle bundles in various directions. So over here the disposition of the stratified squamous epithelium from our knowledge of histology would be best represented by answer D, the vagina. So these are some of the questions types asked in the examinations, and I hope that this would give you a slight idea of what types of questions are asked in the examinations. I wish you good luck. Thanks a lot.